The combined approach to atopic eczema is a behavioural approach, an exercise in behavioural medicine. This presentation briefly introduces the treatment program for adults and older children. A modified version is used for younger children. The combined approach is recommended when atopic eczema or dermatitis has become long-standing or chronic, when conventional treatment can have disappointing results. The combined approach involves 3 levels of treatment built around the vicious circle of chronic eczema. Levels 1 and 2 are the conventional topical treatments with moisturiser at level 1, topical steroids at level 2. And at level 3, the new treatment with behaviour modification for habitual scratching, habit reversal. At level 1, it is important to understand how emollients work. Not by adding water to the skin from the outside, as many think, but by preventing the rapid loss of water from the body fluids out through the skin. Optimally, this can be achieved without keeping heat in too and adding to inflammation. For example, each application needs to be applied sparingly, without rubbing, but often enough to prevent the skin drying. At level 2, the effectiveness of anti-inflammatory topical steroids is explained in order to get the best results without relapse. There are 2 phases of healing, obvious healing and hidden healing. The temptation to stop at the look good point needs to be resisted. The combined approach also requires treatment at level 3, habit reversal. At the first appointment for the combined approach, an initial account of scratching behaviour leads to the first homework task, registration. Each patient is given a hand tally counter on which to register every episode of scratching each day over 1 week. Daily totals are recorded in the patient handbook, together with the times, circumstances and activities associated especially with scratching behaviour. Use of the hand tally counter increases awareness of scratching, disturbs the habit and introduces a little self-discipline. The daily record provides a database against which progress with habit reversal can be monitored, while the pattern of circumstances associated with scratching enables a personal habit reversal plan to be constructed with the patient. This homework can both encourage and demonstrate commitment to the treatment program. And with successful treatment, the use of the hand tally counter is usually mentioned as the most useful part of the program. When we looked at the registration results reported by 50 consecutive patients who successfully completed the treatment program, we found the mean daily scratching frequency before treatment was 200, with a range from 50 to 1,000 episodes per day. Circumstances usually associated with scratching include using the bathroom, being on the telephone, changing one's clothes, and getting ready for bed. The instructions for the combined approach are completed with an explanation of level 3, how to use the behaviour modification technique habit reversal. Typical scratching requires 2 actions: A, moving the hand to the skin, and B, using the fingernails to scratch. Certain triggers or antecedents provoke this behaviour, sometimes itch, sometimes a circumstance or an emotional state. The consequence or effect is damaged skin. To achieve the desired consequence or effect, which is healing, with the same triggers or antecedents, a new behaviour is introduced to make scratching impossible. Instead of the movement of the hand to the skin, the hand is closed into a fist and held still for 30 seconds. To begin with, this can be counted 0 to 30. Then the fist is relaxed, and if there is an itch, a finger is pressed on the itch or the skin is lightly pinched until the itch has gone. With the next stimulus to scratch, the procedure is repeated as often as necessary. All scratching that still occurs is logged as before on the hand tally counter. The second part of the habit reversal instructions involves planning how to deal with certain circumstances when, for example, the fist pinch method is not practical. While some activities that are associated with scratching can simply be taken off the current daily agenda or curtailed for the 4 weeks or so of the treatment program, like some watching of TV perhaps, there are other situations associated with scratching, such as bathing, being in bed, changing clothes, or being on the telephone, that need to continue. But by planning ahead, doing things quickly, and through keeping one's hands busy, these difficult times can be made much safer for the skin. Each patient is asked to draw up their own behavioural prescription, just for the period of the treatment program. The continuing use of the hand tally counter is important to monitor progress. Over a period of 4 to 6 weeks, the combined approach, which achieves the healing curve in this diagram, changes continuous chronic atopic skin disease with acute flare-ups to only intermittent episodes of acute or new eczema. These can be brief episodes that quickly respond to appropriate treatment. They become less and less troublesome as time passes. There are now, therefore, increasing amounts of time without eczema, and overall there is a distinct and welcome improvement in the quality of life. When we reviewed some 250 patients seen in our clinic, we found 15% had failed to complete. Of those that did, 60% did very well, with 25% doing well. Only 15% did poorly. Why not find out more about the combined approach at www.atopicskindisease.com. There is ample opportunity to discover more and discuss the combined approach with others, the behavioural approach to treating atopic eczema. Thank you for your attention.